A very good afternoon. There's a huge number of people suffering from osteoporosis, both men and women, and as the population ages, its prevalence will rise. With an aging population and longer lifespan, osteoporosis is increasingly becoming a global epidemic. Currently, it has been estimated that more than 200 million people are suffering from osteoporosis. Currently, osteoporosis affects 1 in 5 adults aged between 18 and 59 years of age in India. Osteoporosis that's not treated can lead to serious bone breaks, especially in the hip and spine. Many people think osteoporosis is simply linked to old age. The older we get, the more chances we have of developing osteoporosis. While this is true, in some ways, age isn't the only factor involved, and osteoporosis is linked to various other medical conditions. You will be surprised to know that even hormonal imbalances can cause osteoporosis, and the good part is there's a lot you can do to protect your bones throughout your life. In order to prevent osteoporosis, it's important to diagnose this disease early before fractures happen, to test the bone mineral density, and to start treatment as soon as possible. The cornerstone of the prevention and management of osteoporosis is to improve knowledge and awareness among the general public. Today we have with us eminent endocrinologists who can help you understand and manage osteoporosis. A very good afternoon to our panel today. We have Dr. Manoj Chadha, consultant endocrinologist, Hope and Care Center from Vashi. We also have Dr. Thomas V. Paul, professor and head of the Department of Endocrinology, Diabetes and Metabolism from the Christian Medical College in Vellore, and Dr. Sushil Kumar Gupta, professor, Department of Medical Endocrinology, Sanjay Gandhi Postgraduate Institute of Medical Sciences in Lucknow. Thank you so much for joining us here on NDTV this afternoon. If I could start with you, Dr. Paul, how do hormones work? What is their role in our body? Dr. Thomas V. Paul.
Thank you. It's a very relevant question. Hormones, I say, they are the chemical messengers. They are produced by various endocrine glands and released into the blood. Then they act on target organs and they in turn mediate several effects. An excess or deficiency can lead on to the problem. I'll quote an example. There is a parathyroid gland situated. There are 4 glands in the neck. They are very important to regulate calcium. They secrete parathyroid hormone, which have an impact on bone as well as kidney. And another example, there's a pituitary gland in the skull. It's called master gland. They secrete gonadotrophins, LH and FSH. They act on gonads like testes and ovaries to facilitate reproductive functions.
Right. Thank you so much. Let me take my next question to Dr. Chadha. Can hormonal imbalance cause osteoporosis? If yes, which hormones can cause it? Dr. Manoj Chadha.
Thank you for having us on this program. So taking off from where Dr. Thomas left us, see, the bone is a continuously turning over tissue. It's not an inert piece of wood. So he mentioned about the gonadotrophins and the sex steroids. So estrogen is the most important hormone working on bone forming cells. A deficiency of estrogen, which happens classically after menopause, results in the activation or excess activity of the bone eating cells called osteoclasts. Similarly, in males, beyond estrogen, which is in lesser amounts, the testosterone is important in keeping bone healthy. Classically, we keep hearing about steroid use in public, indicated or non-indicated. But whatever it is, steroids are very harmful to bone cells. Thomas mentioned pituitary. Prolactin from there in excess can interfere with bone health. Parathyroid hormone in excess can also be deleterious to bone health. So, there have been times when I remember I started handling osteoporosis, and the ladies in my waiting area used to say, I've come for diabetes and this doctor doesn't treat bones. So this has to be cleared that hormonal health important for bone health and hormonal dysfunction can lead to bone problems and osteoporosis.
Right. Dr. Gupta, do both men and women equally suffer from osteoporosis? What are the general signs and symptoms one should be alerted by so that osteoporosis is picked up early? Dr. Gupta.
Thanks, Divya, for having me here. Actually, osteoporosis affects both genders. It affects more women than men because women have got menopause, which is sudden cessation of estrogen hormone, and therefore they are more predisposed to osteoporosis. If you look at how many people are affected by osteoporosis, it is almost 4 out of 10 women after the age of 50 years in India, they suffer from osteoporosis. It is in contrast to the Western population where only 20% are affected. Even in the man, it is almost 2 out of 10 men after the age of 60 years. Practically, there are very minimal symptoms of osteoporosis. One of the major symptoms is a fracture, actually, either the wrist or a spine or a hip, actually. But there are certain things that can tell you that you might have osteoporosis if you're fracturing with a triple trauma which does not otherwise cause a fracture but causes a fracture, which we call it fragility fracture. It denotes that you have got weak bones or osteoporosis. If there is a reduction in the height by more than 2 inches as compared to the height at the young age, like 20 to 30 years, if you are having a stooped posture, or if you've got a persistent backache, you could have osteoporosis. And elderly subjects who have got marked muscle weakness, they can't come out of the chair on their own, they can have osteoporosis. But in addition, there are more people who are predisposed, like people who have been smoking habitually, taking alcohol, the people who have got a family history of hip fracture in the parents, people who have got thyroid disorders or rheumatoid arthritis, and the people who do not take milk or calcium on a regular basis throughout their young age and adult age, they can have osteoporosis. So it's important to realize that if you've got a fracture triple trauma, it is sure shot that you have got osteoporosis, but other features can also suggest you that you could have osteoporosis even if you don't have a fracture. And our aim is to catch them before they fracture.
Right. Now, age may or may not play a role. Is it possible for young people to develop osteoporosis due to hormonal imbalances? Dr. Paul.
Yes, it's a great question. As Dr. Chadha as well as Dr. Sushil Gupta mentioned, some of these conditions can occur at quite a younger age group. I can quote an example of rheumatological condition like rheumatoid arthritis, hormonal conditions like primary hyperparathyroidism, where there is a overactivity of parathyroid gland, and also I can say that conditions like Cushing's, where there is excess steroids in the body, and sometimes we can have a thyroid hyperfunction, which can cause osteoporosis in younger age group. In addition, I like to mention sometimes the deficiency can cause osteoporosis. The best example is gonadal hormone deficiency, hypogonadism. So they have to be treated with gonadal hormonal replacement. Otherwise, they are at risk, very high risk for osteoporosis, then subsequently can result in fragility fractures. And some medications, as Dr. Chadha mentions, like steroids, can potentially result in osteoporosis, especially in the younger age group. And these we have to be aware because treating these conditions are so rewarding, and we can definitely avoid the consequences of less bone mass and fractures.
Right. Dr. Chadha, how does a person know if osteoporosis is due to hormonal imbalance? Are there any tests that need to be performed? Dr. Manoj Chadha.
So the history is very important. The fact that the patient had a fragility fracture, fracture after a trivial injury, just fall down from the stool or slipped and fell down and fractured, these are all indicators of osteoporosis. We have the blood investigations which are easily available in every part of the country today, starting with the routine biochemistry. We talked about hormonal deficiency. So in selected cases, we don't go around advising all tests for all patients. But if there's a suggestion of extra steroids or extra thyroid hormones or a pituitary hormone defect, we do specific investigations for that. I think what is most important as a gold standard is a DEXA, bone densitometry by DEXA. But I want to put a word of caution here. Number one, it's not available freely in all parts of the country, probably in tier 1 cities, but not in tier 2, tier 3 cities. DEXA has its own shortcomings, and probably we need to look at risk scores, where the patient is more prone to fractures. So the most popular one is the FRAC score, but you've got other scores like OSTA. I think Dr. Thomas and his group has been promoting that a lot across the country. So these are important things to be kept in mind. But I repeat, a fragility fracture is diagnostic of osteoporosis.
Right. Dr. Gupta, how do estrogen and testosterone affect the bone health? Dr. Gupta.
Dr. Manoj Chadha has already elaborated that estrogen is very, very essential hormone for building up the bones, as well as testosterone also. As we grow during the young age, when the puberty development happens, then estrogen and testosterone, they increase the bone mass, they increase the bone remodeling, and there's increase in the bone mass, and we attain the peak bone mass at the age of 20 to 30 years. Estrogen basically buildups of the bone, reduces the resorption of the bone, and therefore the bone amount is maintained at a certain level when we are in adult stage. But the estrogen goes down to the menopause, or at the same other hand, in the man, when we go to andropause, when we have testosterone deficiency, we start losing bone actually. There is a more destruction of bone than formation of bone. So we're in negative bone balance and we start losing the bone. We lose bone almost 1% per year. And this phenomenon is accelerated in the perimenopausal period, or immediately 2 to 3 years after menopause. So just to understand that if you have got a low mean bone mass, or we have a low balance of the bone, and when we attain menopause, it goes further down, and therefore we lose, we have a tendency to fracture actually. So estrogen is important for build up the bones and as well as maintenance of the bone also.
Right, estrogen is very important. With that, we're slipping into a very short break, but we'll be back to separate myths from facts about osteoporosis. To stay with us here on NTV 24/7. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we have Dr. Paul, Dr. Chadha and Dr. Gupta with us discussing osteoporosis. Let me go across to Dr. Paul. Doctor, women can use hormonal replacement therapy at premenopausal age to manage their menopausal symptoms. But can hormonal replacement therapy also help to manage bone health, specifically osteoporosis? Dr. Paul.
Yes, it's a very, very important question, and it's a very relevant question also. The answer is yes, especially estrogen in hormone replacement therapy is protective to bone. That was clearly explained by Dr. Gupta. So, average age of menopause in Indian women varies between 45 to 50. So, someone attains menopause early, before 40 years, what we call as premature menopause. That way, they are at increased risk for osteoporosis. There, we consider hormone replacement therapy, basically to reduce menopausal symptoms, as well as for protecting the bone against osteoporosis. And it usually will be continued till 45 years of age. Of course, we have to be aware that somebody has got a strong family history of breast malignancy, somebody has got a history of prothrombotic states like history of strokes and heart attacks. We have to use caution before prescribing hormonal replacement therapy.
Right. Let's also talk about diet. What's the role of healthy eating habits in the management of osteoporosis? Which foods should one avoid as they might decrease your bone density? Dr. Manoj Chadha.
So if we go back to Dr. Sushil Gupta's statement, our peak bone mass is achieved by 30 years. So if you want to have healthy bones, you don't start at 60 or menopause or 30. It has to start right from birth, continue through adolescence, puberty, and thereafter. We need good amount of calcium in the diet and vitamin D, which unfortunately is not there in our diet. We need to take supplements from outside. The best source of calcium for us is milk and milk products. The other sources are green leafy vegetables, dry fruits. The non-vegetarian people are lucky because they have ample sources of calcium. The important thing to keep in mind, what you mentioned about affecting the bone, is high salt diet, alcohol beyond a certain level, and nicotine or tobacco in any form. These are absolutely harmful to bone cells and should be avoided. Non-vegetarian diet beyond a reasonable level can also affect the bone. So please keep that in mind. Probably of relevance is diet, protein intake. So we need to have adequate amount of proteins, and most Indians don't have 1 gram per kg body weight of protein, and they should take care of that. Some amount of regular weight-bearing exercise, although not a part of the question, is of great relevance.
Right. Doctor is talking about exercise. Let me also take this to Dr. Gupta. Is yoga good for the management of osteoporosis?
Yeah, taking just ahead of Dr. Manoj and Dr. Thomas' discussion, we need to emphasize diet and exercise, yes, but major cause of fracture in osteoporosis is because of fall, actually. And yoga helps in preventing the fall. Actually, it improves the posture, it improves the balance of the body, enhance coordination of the muscles, and there's a greater range of movements with the exercise actually. The person who does yoga has got better muscle strength, better gait, and therefore he has got reduced risk of fall. There are certain studies to show that it possibly might increase the bone mineral density also. But before undertaking yoga exercises, because some of these people can have vertebral fractures also, so one should really consult the expert to start the what kind of yoga is best suited for them.
Right. What's the difference between osteoporosis, osteopenia, and osteoarthritis? Dr. Paul.
Yeah, it's a very very relevant question. Of course, the current gold standard for diagnosing osteoporosis is a DEXA scan. It was clearly told by Dr. Manoj Chadha. So this is a X-ray machine, and what we measure is bone mineral density. And both Dr. Sushil Gupta as well as Dr. Manoj Chadha spoke about peak bone mass. The machine has a reference standard of peak bone mass. There is a database. If a person's bone density is measured, it is measured at spine, lumbar spine, as well as proximal hip, and sometimes in the forearm also. And it measures and compares with this reference standard. And it gives it a T-score. Somebody is said to have osteoporosis. If we have to make a diagnosis of osteoporosis, the T-score should be less than minus 2.5. And less severe form is osteopenia, where the T-score is between -1 and -2.5. And anybody has got a T-score of more than -1, we label them as normal. Of course, osteoarthritis should not be confused with osteoporosis. Osteoarthritis is a degenerative condition affecting the joints, usually manifests as pain, whereas osteoporosis is a porous bone, usually may not be symptomatic until a fracture occurs.
Right. So what about weight? Are obese people more likely to have osteoporosis? Dr. Manoj Chadha.
Well, that's a very interesting question, because I remember 20, 25 years ago, we said obesity protected you from osteoporosis. Obesity had a natural, protection against falls. But we realized we were wrong. The obese people are actually prone to more osteoporosis. And we use a term sarcopenic obesity, obesity with less muscle mass. You see, the origin of the bone cell and the adipose cell is from a common mesenchymal cell. And people who are obese, the common cell tends to go towards production of more adipocytes or fat cells, and their bone cells tend to go down. So
Right.
we have to keep this in mind, that obese people should be given special instructions regarding exercise and weight loss.
Right. Thank you so much, Dr. Chadha, Dr. Gupta and Dr. Paul for joining us on our show Health Wellness Myths vs. Facts on NDTV 24/7. With that, we're sitting a short break. Lots more coming up on the other side.